Hello and welcome to today's NWLC webinar titled Preventative Services in the Affordable Care Act. I'd now like to hand the floor over to Karen Davenport, Director of Health Policy at NWLC. Karen, it's all yours.
Thank you, Teresa. As Teresa mentioned, I'm Karen Davenport. I'm Director of Health Policy at the National Women's Law Center. I'm joined today by my colleague Sharon Levin, who will also be hosting this presentation. So just to start off, the Law Center is a nonprofit organization that has worked for over 40 years to protect and advance the progress of women and their families in core aspects of their lives, with an emphasis on the needs of low-income women. The Center has long advocated for women's health care and reproductive rights, and our efforts reflect extensive research regarding women's specific health needs. First, going to go over what we're going to touch on today, which is we're going to be discussing how the Affordable Care Act will help women access many preventive services. You may be receiving questions about these benefits from your constituents, and we hope that this information will help. The topics we will cover are the Affordable Care Act's requirement for certain health plans to provide coverage of preventive services at no additional cost, when health plans must provide this coverage, which preventive services must be covered, what to do if a plan is not providing this coverage, and resources from the National Women's Law Center to help understand this requirement and to assist in making plans comply. The Affordable Care Act is making landmark changes to our healthcare system. One of the most important changes is moving the U.S. healthcare system towards promoting better health, in contrast to our current system, which focuses on treating individuals once they become sick. One of the keys to doing this is to increase access to and use of preventive services. The law does this by emphasizing prevention and health promotion. Key provisions of the law include investing in proven community-based prevention programs, increasing federal support for preventive services covered through Medicare and Medicaid, increasing public payments to primary care providers, improving access to public and private coverage, including preventive care, and requiring coverage of preventive services with no cost sharing. And that is what we are going to be focusing on today. Many health plans must cover, without cost sharing, preventive services based on the recommendations from the United States Preventive Services Task Force, certain immunizations, preventive services for infants, children, and teens, and certain preventive services for women. So we're going to walk through which plans must cover these services, what the law means by no cost sharing, and the specific preventive services that are important to women that are covered by these requirements. So which plans must cover preventive services? This requirement applies to private health plans that are not grandfathered. So when we say private, we mean that this applies to employer-sponsored health insurance, insurance that people purchase on the individual market, and student health insurance plans, with a few exceptions. And when we say not grandfathered, we mean plans that either did not exist when the Affordable Care Act was signed back in March 23rd of 2010, or plans that existed at that time but have subsequently made changes in plan design that bring them under the law's provisions. This requirement applies to both fully insured and self-insured plans. The only exception is self-insured student health plans, which are not regulated by the Affordable Care Act. Within Medicaid, states must cover preventive services to individuals who are eligible for Medicaid under the Affordable Care Act's eligibility expansion. They are not, however, required to cover these services for individuals who qualify for Medicaid under most traditional eligibility categories, so for example, low-income parents or individuals with disabilities. A recent study found that most states do not cover most preventive services for adults in their traditional Medicaid program. So as we discussed before, cost is a barrier for many women getting the preventive services they need. By eliminating out-of-pocket costs, this provision makes preventive services more accessible and affordable. Cost sharing is the portion of your healthcare costs that your insurance company requires you to pay. A few examples are the share you must pay to the pharmacy for a prescription, the co-payment you make when you visit a doctor's office, and the amount of payments you must make, for example, the deductible that you must pay before your health insurance begins covering your health expenses. These kinds of fees and payments cannot apply to preventive services under the Affordable Care Act. Some doctors or clinics may charge you a facility fee or an administrative fee in order to make up lost revenue if your insurance plan doesn't make up the difference for this no cost sharing protection. You should also question these charges. So you've seen this slide. I'm sorry, you haven't seen this slide before. We're going to move on and talk about the key USPSTF recommendations for women. As you can see, this list includes mammograms, colonoscopies, and cervical cancer screening, among many other important preventive services. We've included a link here that leads you to the full list of USPSTF preventive services. So just want to call out, and it is noted here, that USPSTF recommendations for mammograms is different from what is covered in the Affordable Care Act. What we have here is the ACA requirement. So the other item on the list that we're going to focus on are the particular preventive services for women. These are the 8 women's preventive services defined by the Health Resources and Services Administration as required by the law, which plans must cover under the Affordable Care Act's preventive services requirement without cost sharing. You can see that this list includes some services that health insurance plans have typically not covered until now, such as breastfeeding supplies and screening for domestic violence. We've also included a link to the official website that lists these services. So even though we have lists of preventive services that plans must cover without cost sharing, there have been some questions about what plans really must do and what the services on these lists really mean. The Department of Health and Human Services has provided some guidance on these questions. So for example, does an insurance company have to pay a preventive service without cost sharing if the person goes to an out-of-network provider? The answer is no, the plan does not, unless there is no in-network provider who can provide the service in question. We've provided some of the important details about preventive services coverage here, such as the fact that over-the-counter products need to have a prescription to get covered, genetic counseling and evaluation for BRCA, the breast cancer mutations, include testing for women at high risk of carrying these mutations. Plans may need to cover more than one well woman visit per year, depending on the woman's health needs, including pregnancy, and that coverage of breastfeeding equipment and counseling lasts as long as the woman is breastfeeding her child. At this point, I'm going to hand over to Sharon so that she can talk about the remaining contraception and other issues on the presentation.
Hi, everybody. As you know, and as Karen discussed, there are 8 women's preventive services that were specifically determined needed to be covered without cost sharing. And as Karen mentioned on the previous slide, those were breastfeeding support, screening and counseling for interpersonal and domestic violence, screening for gestational diabetes, DNA testing for high-risk strains of HPV, counseling regarding sexually transmitted infections, including HIV, screening for HIV, all FDA-approved contraceptive methods, sterilization procedures, and counseling and well women visits. One of these services that has gotten a lot of attention is the contraceptive coverage requirement. So we're going to talk about that in a little more depth. As I said before, plans are required to cover all FDA-approved methods of contraception. In the past, some plans have just covered the pill. That is not acceptable. They must cover all kinds. So if you, for example, have a prescription for the ring or the patch, that method must be covered, as well as long-acting reversibles like IUDs. There are certain rules about the coverage of contraceptives that we want to talk about as well. For example, if a generic version is available, a plan can charge a copay for the brand version and choose to just cover the generic with no cost sharing. However, where there is no generic version, the brand version must be covered with no cost sharing. In addition, plans must have a waiver process that allows a woman to access medically appropriate contraceptives without cost sharing, even if there is a generic available. In addition, services related to the contraceptives that are covered must also be covered without cost sharing, like the appointment to have an insertion of an injectable, or a follow-up visit to make sure the contraceptive is working, or if you have an IUD, for example, the visit to have it removed. Another issue that has come up is that over-the-counter products are not covered without cost sharing unless they're available and received with a prescription. So in the example of emergency contraception, which has gotten a lot of attention lately, if you get emergency contraception with a prescription, it can be covered with no cost sharing. However, if you just buy it over the counter without a prescription, it does not need to be covered with no cost sharing. Another thing that has gotten a lot of attention is which plans have to cover contraceptives. And there was recent rulemaking by the administration about this. If you are a religious entity, for example, a house of worship, you are exempted from the requirement that you cover contraception with no cost sharing. However, you have to cover the rest of the women's preventive health services. You're not exempted from that. You are solely exempted from the contraceptive coverage provision. If you are a nonprofit, under some circumstances, you can be accommodated in your coverage of contraception. And what that means is you can arrange to have a third party provide the coverage of the contraception. So if you are a nonprofit that holds yourself out as religious and opposes some or all contraceptives based on a religious belief, and you self-certify to this, you can arrange to have a third party, usually a health insurer, pay for the contraceptive coverage for your employees. If you're fully insured, you would simply have the health insurance company that provides the rest of the insurance coverage for your employees pay for the contraceptives. If you're self-insured, then you contact a third-party administrator, and the third-party administrator then arranges for an insurer to pay for the contraceptives. Another question that has come up a lot is whether or not for-profit entities must cover contraceptives, and they do. For-profits are neither exempted nor accommodated under the rule. These rules go into effect January 1st, 2014. So some nonprofits were given a year while this rule was being written before they had to cover the contraceptives. They've been given an additional 6 months. So if you work for a nonprofit that may be self-certifying for an accommodation, they do not have to have the process in place for coverage until January 1st. So what do you do if you aren't getting coverage? We have a lot of materials available about this that can help you, and I'll talk about the materials in a second. But this is basically the analysis you need to go through. The first question is, does the ACA requirements apply to you? And there are two categories basically you would fall into. The first is this a public insurance program? Generally speaking, public insurance programs are not subject, as Karen mentioned, to the ACA requirements. For this group, though, I do want to note one thing. The Office of Personnel Management has applied these requirements to federal employees' health benefits. So if you're a federal employee and you're covered under FEHB, you should be getting the preventive services with no cost sharing. It is our understanding that OPM is continuously in the process of making sure this is all being done according to the law. But if your constituents are not federal employees and they're in a public insurance program, they are not covered. In addition, and as Karen talked about this also, is the plan grandfathered? And the best way to find that out, and really the only way to find that out, is to contact the plan and ask them if they're grandfathered or not. If you are in a plan that should be covered, in other words, the answer to both of these questions is no, unless you're a federal employee, then it's a yes and a no. What do? The first thing you should do is contact your insurer and find out why they have denied coverage with no cost sharing, and get an explanation from them. This can sometimes take a couple of calls in order to get the right information, but the insurance company is really the best source of information that you can get. If at the end of talking to the company, you either have not been given a acceptable reason for why you were denied. If they have not given you a reason at all and you can't determine why you were denied coverage, or if they've denied you coverage and you're pretty sure that this was done not in compliance with the law, the next step is to file a formal appeal with the insurance company. How this is done varies from insurance company to insurance company, but there should be details of how to do this in your plan documents and your explanation of benefits from the insurer. In addition, you should be able to get it over the phone from the insurer's customer service representatives. We also have sample letters that I'll be talking about in a second that helps to detail the kind of issues that need to be raised when you are appealing a coverage denial. Finally, if the plan still does not comply and you believe they are out of compliance with the law, the next step is to actually go to a governmental authority to file a complaint. By and large, these complaints should be filed with state insurance commissioners. They have the authority to review concerns about plans in their states that are not in compliance with this part of the ACA. If your plan is self-funded, they are actually regulated by the U.S. Department of Labor, and a complaint could be filed with them as well. The other thing that we are looking into is you've probably read that there are some states that are opting not to have the state insurance commissioners administer their ACA plans, but are ceding that authority to the federal government. And in that case, a complaint could be filed with HHS. So we have talked about a lot of things and a lot of ways that you could respond, and you're probably wondering how you know how to do all of this. There's a link on this page that is to a toolkit we have put together on the preventive services. It sets out a lot of the background information that Karen reviewed at the beginning of the call. And then it also has assistance in how you talk to your insurance company to get the information you need about coverage, how to file an appeal. It has template letters for common coverage problems. We recommend it highly. You can find it at www.nwlc.org, Preventive Services. And in addition, we have a hotline. It's called 1-866-PILL-FOR-US, or you can email us at pillforus@nwlc.org. I know the phone number and hotline say PILL, but it's for any of the preventive health services. So if you have an issue getting coverage for breastfeeding materials or for Well Women Visit, please go ahead and contact us through this line. And we have been helping individual women around the country who have had problems getting their preventive services with no cost sharing. I should say, before we turn it over to questions, that we are hearing a lot of good news. And a lot of women are out there accessing the preventive services that they now have a guarantee to under the ACA. But as with any new law, there are sometimes problems in making sure it's implemented correctly. And so we are here to help you and to help your constituents make sure they're getting the coverages that they're guaranteed. We're going to open it up to questions now.
I would like to remind our audience we have two ways to ask questions today. You can go ahead and type your questions in by clicking on the Q&A tab at the top of your screen. We do recommend asking your questions this way just to ensure we get through as many as possible. And you can also press *1 on your touch-tone phone, and we can bring you live to ask your question to our presenters. So I would like to hand the floor back over to Sharon and Karen for our questions.
Sure, we're just pulling them up right now. I know one of the questions.
So it looks like there was some confusion over which plans are required to cover these services, particularly around public insurance. It's a question from Susan. And while we can't give you a list of plans that are not yet complying, we can say that, for example, people who are currently in the Medicaid program, state Medicaid plans are not required to provide that coverage to traditional eligibles, which is everyone who is covered in Medicaid these days. Once it's January 1st, and the Medicaid expansion is implemented in the states that are taking the federal money and covering additional folks through Medicaid. They will be required to cover preventive services without cost sharing for that expansion population. And then as Sharon mentioned, while the Federal Employees Health Benefit Program and the plans that participate in that are not required by law to provide coverage without cost sharing for these services, OPM has made that a condition of participating in FEHBP, and so those plans should be covering preventive services without cost sharing. Medicare has separate rules on preventive services, and Medicare's coverage of preventive services was improved in the Affordable Care Act, but the sections of the law that we're talking about today do not apply to the Medicare program. I hope that answers that question. And then there is another question about veterans asking whether they need to sign up for a plan if they are currently being seen at a VA hospital. So coverage through the veteran system is considered what is called minimum essential coverage under the law. And so people who are part of the VA system may stay within the VA system as the law is being implemented, and particularly after January 1st. And then we have a question about will any insurance cover people while they are out of the country? For example, someone who lives 6 months in the United States and 6 months out of the country. I think my immediate response is I can't answer that definitively. I believe that it in part depends upon whether somebody is getting credits, tax credits to help subsidize their premiums, and if someone is living out of the country, they would not be eligible for those subsidies during that time. If you want to follow up with us, we can answer that. We can, look into it and answer that a little more thoroughly. I just don't recall off the top of my head how that ends up working for everybody. And then we have a question about BRCA testing. That's obviously been in the news a lot since Angelina Jolie came out with her results of her BRCA testing and then her preventive mastectomies, and the question is, how is that covered? The guidance that HHS put out in February was pretty specific about BRCA testing, and what it said was for women who are at high risk, and there are various categories that put a woman at high risk for carrying one of those mutations, for example, having 2 first-degree relatives who have had breast cancer before menopause. That not only is the counseling about genetic testing covered, but the test itself is covered if that is considered appropriate for that woman. So both counseling and the test for the BRCA mutations are covered without cost sharing.
Do people have other questions?
Or if there are folks who would like to ask their question on the phone?
We currently do not have anybody in the queue on the phone.
Okay. If people have additional questions, you can certainly contact us or see if the Preventive Services Toolkit helps answer any of your questions. And Karen and I are both available, obviously, to help to respond to anything that may need further clarification. Or if you have a specific coverage question, please contact us through 1-866-PILL-FOR-US. Or Pill for Us at NWLC.org.
We'll just do one last screen to make sure we don't have any other questions. And it looks like we have covered everything. So, Teresa, I think we can wrap up, and thank you, everybody, for your time.
Excellent. Thank you all very much for joining us today. On behalf of NWLC, I would like to thank Sharon and Karen for their excellent presentation today. Also, we'd like to thank all of you for joining us, and we hope you have a wonderful afternoon. That does conclude today's session. You may now disconnect, and we look forward to seeing you next time.